Happy day. How are you today, Dr. Park?
I'm well, thank you. Nice to see you, lady.
Thank you. Can you please tell us your credentials so everyone who's watching knows your background a little bit?
Sure. I'm an osteopathic physician, a DO. I've been in private practice since 2016. I have two board certifications. One is in physical medicine and rehabilitation, PM&R, and that has to do with injury management and usually a lot of sort of complex chronic pain conditions. And then I did a fellowship in osteopathic manipulative medicine, OMM, to gain some of those osteopathic hands-on skills back that sort of dwindled during residency, so that I could do hands-on work with patients and treat their bodies when they're coming in with pain and musculoskeletal dysfunction. So I incorporate both those trainings into my everyday practice. Yeah.
Okay. The documentary entitled To Heal is the focus of this chat we're having today. One of the foundations of that whole documentary is the emotional self, which
Mm-hmm.
I know we talked about briefly. So you know what
Mm-hmm.
my definition of emotional self was and what your definition is of emotional self or what you thought of it before. So let's just clear that up. Um, what what do you understand when I say emotional self? What do you understand that to be? So when we go further on, we can not have people saying she doesn't know what she's talking about.
Yeah. Uh, so to me, the emotional self is your the patient's response to past experiences, maybe that's trauma, I mean, good or bad experiences, and how that has affected their body in the present moment.
Perfect. So I think that the emotional self also has a place in the physical self, in the, going to say the meat of the body, and things
Mm-hmm.
get stored, emotions get stored. I think this is a
Mm-hmm.
problem for people trying to get out of cyclic situations because their
Mm-hmm.
emotions might bring them back to a situation that's not even related to
Mm-hmm.
what's going on, and it pops it up, and now you have a cycle with another cycle, and it's hard to find where's the center. I think the emotional self, if it's addressed more from the beginning when you first meet them, and as part of a regular, hey, how's it going? What's stress been high, anxiety, did anything traumatic happen? Those things get addressed. Other stuff kind of like whittles away and the center point starts to appear. So for me, the emotional self is all of that. It encompasses a lot.
Okay.
Okay. So I'm going to read this question to you, my dear. Um, And just to be transparent, I did kind of like go over what these questions would be. So you are not shocked, but when you ask questions, sometimes they reword without, you know,
Yeah.
trying. I'm not going to read word by word, but I'm going to get the gist of it out. But you have had a chance to look at the questions beforehand.
Yeah.
So anyway, so the first one I'm going to go to instead of the last one, which I was, what was missing from your practice before which kind of brought you to deciding to go private?
Yeah. Before private practice, I was working at a large academic institution, and you're a public servant, and there's a lot of honor in that, but it wasn't right for me. And a lot of that was because there's so many constraints in that type of system. I mean, the constraints of being held to insurance company standards, like the visit has to look a certain way. I mean, even your interaction with the patient has to look a certain way in order to, check the boxes on the claim form. And so I wanted more time to sit with patients and really understand them and what's the root of this problem? Is this really just a physical issue that I'm seeing? Or are there other layers to this? And I just couldn't do that effectively in that type of system. So I decided to leave and create my own practice.
Okay, great. We know that the executive producer, Robin Paris, had met you because she was coming for medical reasons. She, she doesn't know you any other way but through
Yeah.
practice, yours.
Yeah. Yeah.
One of the things she said that reminded her of what I've been speaking with Robin about for years is that emotional quality. And she had said she went to lay down and get ready for the treatment, and you said to her at that time, go to a place that you love during the treatment to calm, find yourself in a very calming, wonderful place. Good for you. And she
Mm-hmm.
could settle right down. That's
Mm-hmm.
an emotional quality that I'm talking about, that I want to put out there more. Where's the emotional quality? Joy is the word I use all the time because it has no negative connotation. The word
Yeah.
love can be betrayal and grief and hardship. And
Yes.
love is very, very dimensional,
Mm-hmm.
with positive and negative, but you can't be angry at joy. You can't be betrayed in joy. You can't find trauma in joy. So joy is the overriding word I use from VAST, which is what I was taught.
Mm-hmm.
The word is joy. In your vocabulary, the word is joy. So for you, telling somebody that to
Mm-hmm.
let them settle,
Mm-hmm.
that's exactly what I'm saying. So how did that become something that you would say to somebody? And given your field is not about, that's not what you were trained. So go ahead.
Yeah. Yeah. No, it's really interesting, the parallels here, because joy is also a word that I use a lot. And um, I tell patients to sometimes, even in their day-to-day life, to do something, an activity that brings them joy and fulfillment. Because when we are filled with joy, it creates a pathway to connect with the health, or vast, or however you want to say it. And I see patients when they're on the table and I'm doing a treatment. This type of treatment would be not so much the mechanical kind, but more of an energy type treatment. It allows them to be more comfortable in their body and connect to something else that's going to lead them to their authentic self when they're full of joy. And that's really profoundly healing. And it's helpful for me as the practitioner when they go to that place.
Great. I love all of that. Sometimes in speaking to caregivers that I know personally, or my own, or I know them, they often say, as time goes by, they start using more words that deal with kindness, compassion, and care, and people's whole demeanor changes. But sometimes they get more upset because you're giving them kindness and they're not used to it. And then they
Mm-hmm.
go into a sadness because that's like, oh, what did that feel like?
Yeah.
Feelings. It's about feelings, and the emotional body is feelings. That's what it does.
Mm-hmm.
Um, what do you think the medical field is missing right now that could benefit from in this quality? What do you think would be kind of like an ongoing thing if you were to say, I'm going to start adding in more emotional quality into my practice? How do you think that might look for not just you, but for any other type of doctor out there?
Yeah. Um, I mean, I think for patients, right,
Yeah.
to sit there in the doctor's office and have a doctor sit and really listen to them and try to understand what they're saying. I mean, that is just so comforting and validating for them. And you can build this trust and even allow some vulnerability in the patient. And there's so much more that comes out of that. I mean, you're just sitting there with them and listening. They may release some of these, negative stuck emotions that are contributing to their physical ailment. And so it can be as simple as that. And unfortunately, right now, there's such rush in the medical system that we're not taking enough time to really sit down with patients and listen. Because sometimes that story leads to something really interesting that's going to help me figure out what to do and how to problem solve it.
Yeah, exactly. This is, I love what you said so much. It's, to me, getting this point across to as many people as possible, and also their own wellness. They participate in their wellness. It's not the doctor only. No, when you go to the doctor for help, you can't decide you need or even know what that answer might be. But your
Mhm.
emotional self, you can do something about at home and bring a healthier emotional self to it, right?
Mm-hmm.
So this is
Yeah. Yeah, I think patients, as much as we want to help them, there also has to be some accountability on their part. You can't just show up at the doctor's office and expect to be healed completely. We have to sit down and say, what is preventing you from achieving a good quality of life? And what can you do at home on your own? And maybe they need a little bit of help getting there, but there's so many things that patients can do outside of the doctor's office to improve their ability to heal.
Yeah, exactly. Tell me, you have a lot of different clients and all different body types, all different ages. Do you find any age group is more susceptible to emotional things to you, like saying, oh, today I feel like this, versus another age group?
Oh, that's really interesting. When I think about it, um, I think that my older population um, tends to realize that they have been holding on to emotion and they're getting to the age where they're slowing down, or maybe they're going to retirement and they're like, wow, I've carried this weight for a long time. And I think they previously did not deal with these problems. And so now they have more physical pain in the present moment. And they're ready to deal with that. And so that's really exciting, and get them set up, with me or with other counselors or therapists, thank goodness for them too, to help deal with these problems. In my younger patients, a lot of them go to therapists, and I think it's more accepted maybe in society to um, go to someone for help, but not so much in the major medical systems. I don't see that as much. But I think my younger patients, it's more acceptable than it used to be to get mental health support.
I think you're right. I find most of the younger population, and we're talking about 20s, 30s, 40s, 50s, you're starting to get a clue you missed a few decades in emotional
Yeah,
distress. But
right.
they all know the word mental health is an acceptable term now, and
Yeah.
therapy is an acceptable term now. Just like
Mm-hmm.
before, if you were going to the chiropractor, that was like quack science, or now it's not, because we've moved on. But I
Mm-hmm.
think we're letting the younger populations know this emotional quality is so important. Don't
Yeah.
disregard it,
Yeah. Yeah.
Um,
There was another point I wanted to make, Lady, about the medical system, and from my experience having worked in both sides in an academic institution and in the private practice. And gosh, I mean, just talking to my own patients and, their difficulty trying to navigate the major medical systems, and is that we're so fragmented. I think that would be the word to use. And we're so subspecialized, and we need all these subspecialists, right? But we totally lost the forest for the trees. Like, we're stuck in the trees. And so who is going to look at the whole? I mean, the primary care doctors, they have so much on their plate. They're tired. I mean, it used to be them, but now we might need somebody else to look at the whole and put the parts back together. And we know we are so interconnected, right? Just the fascial connective tissue system runs from our feet to our head. And if
yes.
you if we alter one part, you have one small surgery, could totally unbalance or upset the balance of the entire system. And we always have to keep that in the back of our mind when we're looking at a patient. And sometimes patients come in and they've been diagnosed with 20 different things. But the more I talk to them, we can usually trace it back to maybe one or two things that happened. And then it's been like a domino effect since then. And so we're trying to march our way back to the root of the issue.
Like my friend said, we're trying to go back to great grandma's time and heal from basics and move forward. It's okay. We all need every single thing that's available to us. We need science, we need medicine, but we also need the basics. We need to go back to the basics. And it seems like they are going back to pick up the tools of the basics and bring them forward. And that did always include, how are you feeling? That was the first question. What do you feel like? Where does it hurt? How does it feel? Those questions seem to be eliminating through time. And because I'm older, so I've had a lot of different doctors in a lot of different countries. And you see the things come off. The how are you feeling? How's it going into, okay, what's the problem? Not anything else. Now it seems we're trying to look back with the lifestyle medicine I was telling you about. That one of the hospital organizations where I'm at, and it's about this joining together you're talking about. So
yeah, that's amazing. You know, I hadn't heard of lifestyle medicine specialty until you mentioned it, and I looked into it and I thought, oh, they are looking at the whole person, and we need that to really heal from the inside out. You know, nutrition and community and exercise. And I realized that I do some of that in my practice because, you know, without it, how am I going to treat someone in pain who's got a complex pain condition? I mean, you can't. So that's really exciting that they're working on that.
yeah, I was thrilled with it.
Yeah. I mean, I guess not knowing about that just for fun and to help my patients, I got my yoga teacher training and as well as more recently, my certificate in personal training, because I have so much joy when my body gets to move around a lot. And so I want to be able to give that to my patients. I mean, a lot of them are scared to go to the gym or get a trainer. And so now they can set up a session with me. And I already know their body and I know their background, and we can just set up a routine for them that feels right. And, you know, hopefully is improving their quality of life.
Well, it's been a pleasure speaking to you. From meeting you yesterday till today on this call, I just think more like you, please. More like you, please. That's what I want to keep saying. Thank you so much for being on with Entitled to Heal. We appreciate everything that you've said. Like I said, I loved meeting you. I loved your table. It was really a great experience to be with you. So I'm going to sign off now. Is there any last word or any last thing you would like to say to anyone that's listening that isn't from your field of work?
Sure. I first want to say thank you to you, Lady. It's been such a pleasure to talk with you and exchange ideas and hope for the future for medicine and healing all people. And I also have a question for you, Lady.
Yeah, go.
Yeah. So you know the adage that you can pass away or die from a broken heart.
Yes.
And I thought that was, you know, what do I want to say, relevant to this conversation. What are your thoughts on that, since it seems like it's something that we should look at?
My first thought when you said a broken heart is it's real.
Mhm.
It's true. It's possible, 100%. How do I know that? I've been practicing for 45 years, and my whole
Mhm.
focus has been humanity, contact humanity, and alternative vibrational healing. That's my life. I've done that. That's all I've done. So I've seen many people, and I've seen the brokenhearted. That the facts are that is the only thing that was happening was how devastated they were from many different sources.
Mhm.
I want you to think of the body and its parts.
Yeah.
Like, like the fascia, you're all in one part and everything's working together. If you take something that has been so attacked emotionally, so devastated emotionally, like especially the heart, which is the heart mind is the emotional mind. That is it. You have your brain mind, you have your heart mind, you have your gut mind, which they now understand the biome and how it has its own setting out its own frequencies. Then you have your spinal fluid that most people miss. But that
Mhm.
spinal fluid runs the entire body, sends all kinds of information, and joins together. Now we have four minds, right?
Mhm.
And they all come back up to the top and it starts all over again. The
Mhm.
body's miraculous, but heart trauma is one of the hardest ones to fix because everything comes back to the emotional quality. I think
Mhm.
when you have somebody that's really devastated, the biggest thing you can do is hug them as long as possible, as long as they'll let you at first. Let them
Mhm.
know that there is a feeling, a sensation that it can be okay because
Mhm.
they have no hope. When their heart breaks, they're hopeless. Now, I don't use the word hope that much, but in this case, I think for everyone listening, they'll understand that word. You've taken it away. To give it back, you have to give more loving, kindness, joyful emotion back. Number one, hugging. You can't, it doesn't come any faster, and it's the easiest thing to do. The next thing you can do for them is to remember they're attached to what? Mindset has to be adjusted. They have to start thinking more positively. We have to replace words, replace the verbiage that we're saying in our heads. And there's things you can do for that. You have to have the lungs working better. You have to breathe better. Breathing patterning, breathing techniques work for that. You have to have the kidneys flushing and moving well, drinking clean water, simple things. You have to have the spinal fluid moving, the gut going, feed your biome, feed them the kimchi, feed them the sauerkraut. I don't care if you don't like it. Just taste it for like an hour. It's a spoon. It's not like drink a jar, or eat a jar. And then you have your spinal fluid that needs it movement. You need to move. So somebody that
Mhm.
gets hugged, somebody that walks, somebody that decides to have a little kimchi or a sauerkraut in, and they're doing breathing techniques and thinking, it's going to be better because I'm better. And they start feeling better. Everything starts to reverse and the attachments start to happen. Broken heart means we have a nervous system that's not working well. We have a breathing system that's not going to work well. We have a kidney system, a liver system, pancreas, gallbladder, everything is affected, as is the gut. Our biggest second brain is the gut. So yeah, it's real. I think that there are simple things we can do to help it along. I think your profession is probably one of the first things to go to because you're going to deal with all of that and you're going to deal with structure at the same time. That's some people who can't move easily. They'll want you to help manipulate them to get them going, get them revived. So yeah, I know it's true, and I know I've helped a lot of people get to a certain point, and then they can go on. This field that I'm interested in and been doing isn't about someone keeps coming to me. You don't have to keep coming to me. If I'm doing my job, you don't need to keep coming to me. You need to come. I'm going to help. I'm going to teach. You're going to do. And if you need me later, then you can, check in. But it's not every Thursday be here. That's
Mhm.
not self-healing. So the
Yeah.
heart question, I hope I gave you some clarity on it.
Yeah, thank you. And I think I would suggest to individuals and, patients out there who want to, connect to VAS and connect to the health and have a better quality of life is to, um, yes, go to the doctor and maybe you have to go a little bit more often to sit down and have a conversation. They may not have a lot of time, but maybe you have to set up another appointment so that you can have a little bit more time to flush out what's going on. I think, the majority of doctors, truly want to help you, but
Yes.
it's just the system is sort of not in their favor. And so I think, creating more opportunities and time to develop that relationship can be really helpful. And then, as you were saying, outside of the doctor's office, seeking support from peers or therapists or movement specialists or whatever it is, to help get that body going.
I agree. That's why we both have our places in the system of wellness.
Yeah.
Everybody has their place. Mine, I know what mine's limited to. I know what yours is. We all know where to go, but it's together. Right. It's the oneness that it brings. So each person can be responsible for themselves and seek in the right direction what they need.
Mm-hmm. Yeah. Cool.
Okay, darling. Thank you so much, Dr. Park. Really.